I spent 2 months looking at the websites, reading reviews, talking to colleagues, doing demonstrations, online demonstrations with the vendors, and Waiting Room Solutions was by far the best to meet my needs and be reasonably priced. Amazing Charts, which looks like a very nice little company, but it's not real sophisticated and you have to do a lot more input yourself. And I talked to some practices that hadn't met meaningful use in 3 years. And it was very inexpensive. If you didn't want to spend any money on it, it's basically almost free or is free. And there's a minimal charge for support. But I just decided it wasn't sophisticated enough to meet my needs. And like I said, they're a very good company, but I just felt it wasn't going to work for me. He did the hour-long demo. I felt very comfortable with him. He showed me all the aspects of Waiting Room Solutions, and I asked a lot of hard questions like, how am I going to track my EMRs, and how am I going to track preventive care, and how am I going to do Medicare wellness exams, everything I do every day. And he was able to answer all those questions, and he actually gave me a login so I could go and play with it myself, go into WRS, do test patients, and see how it actually worked. And it was not, it wasn't super easy, but I could kind of figure it out. And some of them, it just seems like it was just going to take forever to learn how it worked, but it was more intuitive. 3 months and about a week after I started using it, I met meaningful use and I got my check in August. When I started this on April 1st, I got my check in August for my first payment for meaningful use. So what we did is, of course, WRS has it all built in. There's a module, a training module for meeting meaningful use. And you watch that thing and it explains why you have to do all these different steps. And there's an easy tracking built in the meaningful use module. So you can go to, there's 25 criteria all in a list. You click on that one, say run report, and it will tell you whether you're meeting meaningful use in your charting. You don't have to do anything extra. You have to do their vital signs, you have to do their weight, you have to do document that you ask them their race and ethnicity and whether they're a smoker. All the things that are required are all spelled out. And so you can run this test, see if you're meeting meaningful use, and if you're not, you can fix the issue. For instance, when I first started out, my front desk didn't realize you have to ask their race or ethnicity and put it in there because that's meaningful use. If your front desk doesn't see why that's important and doesn't do it, you can find out and fix the problem and meet your meaningful use. Training was great. They worked around our schedule. We did a lot of noontime where we bring in lunch. It's all GoToMeeting, so we have the speakerphone. They take over our computer. We watch what they do. We ask questions. So they set it up on our schedule. They answered our questions. At first they just told us general things, but then we would write down what we needed to know, and we would come back to our next session with all of our questions we needed answered. So it was very much specific to our practice. And then of course there are the webinars, which are for general information. And then of course there's the self-training videos in WRS, which we found really helpful. Because we'd figure out how to do something, we had the training, and then a few weeks later we'd scratch our heads and say, how did we do that? And you can go watch the video again. And I hired a new person, another extra person, to help put in all these codes and put in all this old data. And we just had her sit down and watch the videos. We didn't have to show her everything. She could just watch the videos and learn how to do it right the first time. Yes, Kentucky passed a law for patients on certain narcotics and controlled substances. Every 3 months, we have to run a report on the Kentucky all-scheduled prescriptions database to see whether that patient has been getting narcotics or other controlled substances filled from other doctors. In other words, doctor hoppers. They'll go see one doctor over here and another one over there and get narcotics from all of them. If they have them filled in Kentucky, you can get a report that'll tell you what else they've gotten. So we have to run that every 3 months. Well, that's kind of hard to keep track of. When did we run that last? Look at EMR all notes, check the date of the last capsule we scanned in. Well, I set it up to track the V code for monitoring of high-risk medications or something like that, and put in the list of medications that have to be tracked, and put it in order tracking and said it has to be done every 85 days so we don't miss it. And then when the patient needs that done, it clicks up, patient needs a Casper report today. So we know to do the Casper report that it's been 3 months. And we also have to do a drug screen at least once a urine drug screen. So we have that programmed in at least once a year. So if they haven't had a drug screen yet, that test pops up as due. So we don't have to be trying to remember when the patient last had it. WRS just tells it we have it programmed in. Yes, I have quite a few patients who do use it. Many of them really like being able to sit at their computer and send a message to us whenever they feel like it. It's not urgent. They don't want to call on the phone when they're at work and try to catch us between patients. They just send a message through the patient portal. And that works very well. Then we can answer those at our convenience. I've had patients message us and want refills, they want to make an appointment, and they'll send a message through the portal and say, oh, I'd like to come in one of these days, and then we just make the appointment and message them back. So it saves us having to play phone tag or them having to leave us voice messages. It's very convenient to not have to sit there and write out all the prescriptions. Some of our patients take 10 or more medications. In the WRS, you can easily track what you've previously prescribed and just click on it and re-prescribe it. You can put in new prescriptions and then move them to the current prescription, so you keep a list of their current prescriptions. So it does save a lot of work. We do our best to make our patients bring in their whole stack of bottles so we can reconcile their meds and make sure we're keeping track of them. We get tornadoes. If a tornado demolished my building, I could find office space, go buy some PCs, and be up and running in a day. I mean, not a day, but I wouldn't have to, I mean, I've still got my old paper charts, but I've got enough data in WRS. If my paper charts got destroyed, it wouldn't be the catastrophe that it would have been 7 months ago. So that makes me feel better. And I know that they have bi-coastal backup. So if the New York State blows off the map, hopefully not, but there's a backup way off site for them. So my records aren't likely to be lost. Well, it had to be certified. I mean, you don't even get meaningful use money if you don't have a certified EMR. And the fact that it was designed by a physician means that it's designed to go with physicians' workflow. They know what they need it to do. A lot of them, some of them, I think, have been designed more by computer people who don't understand patient flow. Do your homework. I have a colleague right now who is really struggling, and I just think they made a bad decision. I don't know the name of the EMR they picked. I told them they should look at WRS, but they didn't listen. They let their billing person pick the EMR. Huge mistake. The doctor's got to get their hands in and figure out how it's going to work in your day-to-day practice. And if you can't be convinced of that up front, you're never going to be happy with it, and you'll end up switching. But I can easily foresee I'm going to retire with WRS.